Hi, my name is Maria Gould, and I'd like to talk to you about a program that I teach called the Dawning Light Bodyworker Program. This is a 10-session program that helps align the body, and from internal organs to externally the structure. We align the meridians so that the body can create perfect health. We ignite the light within you, and the miracles just happen. I get privileged to see miracles every day.
So, hi Nala, how are you doing today?
I'm doing good, thank you.
Good. What can I help you with?
My back and neck have been a little stiff and sore, and a little bit of digestive issues that I would like you to have a look at.
For sure. Let's take a look at that. So if you wouldn't mind lying down. The bodyworker technique that I do uses a lot of different schools of thought. I use muscle testing to assess the body if there's any misalignment issues, structurally as well as with internal organs, energetically. So we treat the whole body, mind, body, spirit, and integrate all into perfect health. Okay? So with muscle testing, I use Nyla's legs because they won't get tired like using different muscle groups. So what I want to do is you'll be learning all of these techniques yourself, but I get a strong muscle. And muscle testing actually allows us to communicate with the nervous system and ask the body yes or no questions. And you can get very accurate information with this, and it's a beautiful diagnostic tool. When I touch different areas of Nyla's body, I'm actually tapping into the nervous system and asking if what I'm testing is in alignment. So everything is strong so far. So notice that the leg moved, okay? That's telling me that what I tested is a little bit out of balance. So I'm going to test where that stomach might be, because the internal organs actually move out of alignment and causes a lot of our ailments like acid reflux, heartburn. If the colon is not in the right place, we can have things like constipation or painful periods, pain in our lower digestion. We can have uterine problems or period problems for females. If the uterus is out of place, just a lot of conditions can be easily fixed with this technique and save people loads of pain and suffering. So I've just finished moving Nyla's transverse colon into alignment. So we're going to double check that the body is happy with that. Perfect, nice and strong. So I'll just continue to check the rest of the internal organs quickly, checking the pelvis alignment, checking the pubic bone and the tailbone, all of the leg bones. Anytime any of our structure, our skeletal structure, is out of place, can cause a lot of discomfort and a lot of different conditions that can easily be treated with this technique very painlessly and gentle. 1, 2, 3, 5, 6, and 7. Okay. So notice that I don't always have to touch the body in order to tap into that energy. Once you get really efficient at muscle testing, just running the thought of what you're testing through your mind, their body feels that energy because you're tapped into their energetic system. So you can become very efficient at muscle testing and actually learn to be a surrogate muscle tester. So now we're going to align a couple of vertebrae. So when I was testing Nyla's body, it said that her thoracic 10, which means T10, is out of alignment. So have you been getting discomfort in this area, Nyla?
Yes.
Any pain when you take a deep breath?
No.
No pain? Okay. So the reason I ask her that question is if there is pain when you take a deep breath, usually a rib is getting affected as well. So all she's going to do is I'm going to kind of work the muscles a little bit looser. Okay, nothing major. She's actually not too tight around that vertebrae, which is a good thing. So I'm just going to find the point to hold, and she's going to take some deep breaths. And I'm only using about 5 pounds of pressure, so it really doesn't take a lot to align the vertebrae. Notice there's no force needed, there's no strong action needed to align these vertebrae. We can do it just so gently. I work on babies, I work On the elderly, this technique is so non-invasive and wonderfully balancing. There it goes, and it moved. Perfect. So really, it's her body's breath with my slight pressure. Her body actually just invites it back into alignment. So there's, as I said, no force needed. So Nyla, how are you feeling after the treatment?
Oh, I feel much better.
Yeah, your back is feeling better?
It is. No pain.
Good. And what about your internal organs?
It feels right. It feels like it's in proper
So
position.
Jasmine, how can I help you today?
I'm just generally feeling today, last few days, pretty sore, just general stiffness from over-exercising a bit, and drained, heavy sense of fatigue and tiredness,
Okay.
bit overwhelmed.
Okay. Okay, let's take a look at that. If you don't mind, lie down. I'm going to take Jasmine through just my simple diagnostic treatment with muscle testing. So first of all, finding that strong muscle, checking that all of her circuits and her brain is communicating with her body effectively. Then I'm going to go through and check all of the internal organs, and those are all in perfect alignment. Now, something that can go a little bit off with the body is our meridians, which are our lines of energy that move through all of the organs of the body. So when a meridian is out of balance, it's either got too much energy running through it or not enough energy, and that can cause all types of different symptoms. So I'm going to check her meridians, her 12 major meridians, and see if that's some of her fatigue. 12. Okay, so the 12th meridian is our circulation sex meridian, so having to do with our pelvis being balanced. Made sense because you did have your hips and your L5 out earlier. Those are usually go classic with the circ sex meridian out of place. Okay, you'll get fatigue with that one, hormonal shifts up and down, feeling quite emotional. Because it can be out of balance, let me just check if it's out of balance with thyroid. So deficient, excess, yeah. So excess means that there's too much energy running through it, so it's actually probably stealing energy from your thyroid. So that can be a lot of the tiredness. Okay, so I'm going to start balancing this and help you feel better, more energy. Okay, so when we balance the meridians, we're rubbing certain points that if you were to go to a Chinese doctor, they would do a pulse test, similar to what I did, but I use muscle testing to assess that imbalance. And then rather than using needles, I just use acupressure points. It's not very painful. Sometimes the points can be tender because they have been out of balance for a while, but nothing making us want to cry.
No.
Okay. So have you been feeling like you're coming down with a cold or anything like that?
My head's been heavy, but yeah, like allergy feeling in my sinus kind of sneezing a lot.
Yeah. Anytime the thyroid is sacrificed some way energetically, you'll get those nasal symptoms, feels like you're coming down with something. So you'll learn how to balance 12 different major meridians in the body. I've seen it help people, you know, when they get their thyroid energy balance, they actually don't need to be on thyroid medication if they were just out of balance, okay? And if we catch it before they're on medication, then they are stuck there if they're on medication. But it can definitely help alleviate a lot of the symptoms and lessen the symptoms. Right. So we're gonna, this is a source point, called a source point for balancing this meridian, and it just helps basically plug that circuit in again so you're feeling a little more energy. Have your arms been tired?
Yes.
Yeah. Yeah. That's not good in your profession.
No, I notice that when I'm doing massage, my upper arms get quite tired fast, and they don't usually.
I've seen people that have this meridian off, just like you do, and get elbow problems. Because the meridian runs right through here for one of them, and through the other side.
Oh,
yeah.
wow.
Yeah. So all kinds of symptoms can come when these are out of balance. Okay, so some of the major meridians that you're balancing, you're going to do small intestine, you're going to do heart meridian, you're going to do gallbladder, liver, bladder, kidneys, colon. I'm just trying to remember all of my meridians. Lungs, as well as stomach, and then we go into spleen, pancreas, and then thyroid and circulation sucks. All right, Jasmine, so how are you feeling after a session?
Good. I'm lightheaded a little bit, and not in a bad way. Just feel a release of pressure.
Yeah, part of that meridian being off balance is pressure in the head. So
yeah, I can feel the difference in here, and just the general lightness.
Yeah, good. And any shift in energy level yet, or?
Yeah, I felt
bit.
it starts here when we've done energy in the body practitioner. I've noticed it's always right here that I'll feel more energy.
Yeah.
As I have been on thyroid medication,
Yeah.
I feel it again when we actually get it kind of spark or energy flowing through it or the right amount.
Yeah.
It always seems to help right away.
Good. How are you?
I'm good, Maria. How are you?
Good. So would you like to tell me a little bit about what the technique has done for yourself or your family?
Definitely. With my husband, he had really bad heartburn and indigestion, where he was taking tubs and Rolaids throughout the day to help with the ease of the pain. We came to see you, and you showed him how to pull his stomach down so that way it would lessen it and take it away, and that has helped tremendously.
And he's able to maintain that on a...
He is, and the Rolaids and tubs, they're pretty much non-existent.
So you're taking currently the Bodyworker program with me.
Yes.
And what drew you into the program? What inspired you?
Just before my 30th birthday, I was diagnosed with a really rare form of arthritis that's crippling. I went to a certified body practitioner, and we worked through a lot of my pain and inflammation just naturally. And when I heard that you were doing the course, I was definitely interested and excited to see where that could lead me with my clients.
Perfect. So you work in this industry already?
Yes, I'm a spa therapist. I own a small spa, and I specialize in more healing modalities is what I'm looking to specialize in, rather than just typical salon massage and spa massage or waxing. I have a different goal, and I've been able to, just with the classes that we've done already, see huge benefits to the clients that I've been working on. A lot of them are chronic pain, illness, and we've been able to get them to levels of happiness and a better quality of life with this 1 or 2 treatments, 1 or 2 different techniques that I've added into the services that I provide already.
Yeah. That's wonderful to hear. Love to
It's
hear.
exciting.
It is so exciting. So today you just finished the muscle testing component. How was that?
It was one of the most interesting things. I've been looking forward to taking it since we talked about it before we even signed up for the class. It's something I recognize from when I've had it done by you or different practitioners, but it was really exciting to learn, and I think it's just a fun technique that can unlock so many mysteries to the body.
That has helped your family with so many ailments. Has that inspired you to do the training with me?
Oh, very much so. When I found out that you could realign and help a person's body virtually pain-free, it was very inspiring for me to take your Bodyworker course, so that way I could help others the way that you've helped me and my family.
Oh, that's great. We're excited to have you in the class.
I'm very excited to be taking the class.